Hello viewers, today we will discuss that why angiotensin converting enzymes inhibitors produces the side effect of this dry cough in this 20% of patients. It means that why 20% patients says no to the administration of angiotensin converting enzyme. This is due to the production of the dry cough in these 20% of patients. Before starting up dry cough, let's comes to know the RAS. RAS means renin-angiotensin system. In RAS, when there is a decrease in blood pressure in the kidney or decreased blood supply of sodium or water into the kidney or increase in the concentration of sodium in the distal convoluted tubule when these type of conditions occurs in the kidney, there is the stimulation of an apparatus in the kidney known as juxtaglomerulus apparatus. Due to these conditions, when juxtaglomerulus apparatus are activated, there are special cells in the juxtaglomerulus apparatus known as macula densa cells. These macula densa cells are stimulated due to these conditions. In turn, these macula densa cells stimulate the special receptors that are present in the afferent arteriole of the kidney, and in turn they produce an enzyme known as renin into the blood vessel. This mama means renin comes to the liver and convert the angiotensinogen to angiotensin 1. This angiotensin 1 is an inactive decapeptide enzyme that are converted in the lungs by an enzyme known as angiotensin converting enzyme to the active substance that is known as angiotensin 2 enzyme. This angiotensin 2 enzyme are the active substance when they act on different tissues or organs in our body. They control different conditions. For example, when this angiotensin 2 receptor act on angiotensin 1 receptor that are present on the smooth muscles of the blood vessel, they cause smooth muscles contraction. Due to this smooth muscle contraction, there will be the vasoconstriction. Due to this vasoconstriction, there will be the decrease in the diameter of this blood vessel. They increase the total peripheral resistance. And due to this increase in total peripheral resistance, there will be the increase of blood pressure in these blood vessel. Blood pressure means the pressure of the blood against the blood vessel. So due to this vasoconstriction, there will be the increase in the BP. Along with the blood vessel, angiotensin 2 by acting on the angiotensin 1 receptor that are present on the cortex of adrenal gland, they produce a hormone known as aldosterone. Aldosterone by acting on the tubes of the kidney, they act as a reabsorption of water and sodium into the blood vessel. Due to the reabsorption of this sodium and water into the blood vessel, there will be the increase in blood volume, and due to increase in blood volume, there will be the increase in the blood pressure in these blood vessels. Along with the action of this angiotensin 2 on these two regions, they also act on the posterior pituitary gland and produce a hormone known as ADH, antidiuretic hormone. This diuretic hormone, by acting on the renal tubules, they cause the reabsorption of water into the blood vessel, and as a result increase in the blood volume, and due to this increase in the blood volume there will be the increase in the blood pressure. So due to the increase in the blood pressure and increase in vasoconstriction, they cause different problems in our body, like myocardial infarction, diabetic nephropathy, chronic kidney dysfunction, stroke. So to treat these conditions, we have a lot of medicines, a group of medicines which are known as angiotensin converting enzyme inhibitors. These contains Captopril, Enalpril, Ramipril and Lisinopril. They are ends with the name of pril. So by acting of these group of medicines on this angiotensin converting enzyme, they block this angiotensin converting enzyme, so this mama will not be converted into this angiotensin 2. Due to these conditions, they will not act on this blood vessel, so the smooth muscles will not be converted but contracted, but it will be relaxed, and due to this relaxed condition there will be vasoconstriction, there will be vasodilation, and due to vasodilation there will be the increase of the diameter of this blood vessel. Due to the increase in the diameter of blood vessel, there will be decrease in total peripheral resistance, and as a result the blood pressure will be decreases. And also by blocking the aldosterone system of this angiotensin 2 on the adrenal cortex, they decrease the reabsorption of water and sodium, so the blood volume will be decreases, and due to decrease in the blood volume there will also be the decrease in the blood pressure. So, and also by blocking the posterior pituitary gland action, the ADH will not be released, so the ADH will not act on the renal blood tubes. That's why the water will not be absorbed, so that's why the volume will not be increased, and so there will be the decrease in the BP. Due to this decrease in the BP and this vasodilation, these ACE inhibitors are used in different medical conditions such as myocardial infarction. In myocardial infarction, there is the necrosis of the muscles heart due to low blood supply in the blood vessels. So when we take these angiotensin converting enzyme inhibitors in those patients, there will be the vasodilation, so there will be increased blood flow towards the heart. Along with the myocardial infarction, angiotensin converting enzyme are also used in stroke. Stroke means when there is low blood supply towards the brain, which act on the same mechanism as that in myocardial infarction, that increase the blood volume, increase the diameter of the blood vessel, so they will increase the blood flow, so the stroke problem will become decreases. Along with the myocardial infarction and stroke, The angiotensin converting enzyme are also used in chronic kidney dysfunction and also used in diabetic nephropathy, which will be discussed later in detail. Along with the use of this angiotensin converting enzyme in these different medical conditions is very good and very efficacious, but there is the side effect of angiotensin converting enzymes, and due to these side effects most of the patients stop the administration of these angiotensin converting enzymes, and these side effects include increase in the accumulation of this bradykinin. It means angiotensin converting enzyme inhibitors along with the acting on the enzymes that are involved to convert the angiotensin 1 to angiotensin 2. Angiotensin converting enzyme inhibitors are also block the enzyme that are involved to reduce the amount of bradykinin in the lungs. So when we take these medications, they block this angiotensin converting enzyme, and due to the blockage of this angiotensin converting enzyme, this bradykinin will not be converted into inactive metabolite, and as a result there will be the increase in the accumulation of these bradykinin in these lungs. So when the bradykinin increase in the lungs, they cause C fiber irritant and produce a substance P. They produce these two types of substances in the lungs. By the production of these substances act on the stretch receptors and C irritant fiber receptors that are present in these lungs. So by the action of these substances, they cause the smooth muscles contraction, and due to these they cause bronchoconstriction, and due to these bronchoconstriction they causes the side effect of dry cough in around about 20% of patients. So that's why around about 20% of patients stops the stop the continuation of the angiotensin converting enzyme. So when a patient start for the first time these medication, and if he or she produce a side effect of dry cough, they will either change the class of the drug or will decrease the dose of this angiotensin converting enzyme inhibitors to reduce the side effect of dry cough in these